Hello and welcome back to Nicu&You, the podcast that holds space for the real, the raw and often unspoken experiences of neonatal care. I'm Belle Stevenson and today's episode is part of our ongoing conversation around perinatal mental health, the lived experiences, the support, education and shared understanding, and I'm really grateful you're here with us today. Before we begin, don't forget to like and subscribe as this helps us reach and support more parents on their NICU journey. Also, a quick thank you to our sponsors, Salento and Meritcom in Strabane. Both Salento and Meritcom support Nicu&You and have been great supporters of the One Day at a Time project. You can find out more at nicu&you.co.uk. Today's episode is deeply moving and incredibly important. I'm joined by Lesley and William Mealiff from Salento, Strabane, who are here to share their own personal story from 25 years ago. Their third child, Ralph, was born after a normal full-term pregnancy. Everything seemed just as it should be, but then at just 9 days old, in the safety of their own home, everything changed. Lesley noticed her baby was struggling to feed and trusted her instinct enough to call the midwife. She has since said that if she hadn't made that call, their story could have taken a very different turn. What followed were some of the most difficult and emotionally challenging days of their lives, as their baby was transferred for emergency care, requiring surgery for coarctation of the aorta. This is a story of worry, fear and tears, but also of immense resilience, love and incredible strength. It's also a reminder of a time when support looked very different, when there was little in the way of mental health support for parents and families leaned on each other just to get through. We're listening to this conversation today not just because it matters to us, but for anyone listening who may be going through something similar right now and needs support. This is Lesley and William's story. Lesley and William, thank you so much for being here today.
You're welcome.
I suppose if we just take it right back to the beginning. Lesley, what do you remember about your baby's birth, the first few days after the birth, even the pregnancy? Excuse me, frog in my throat.
Yeah.
Was it a normal pregnancy?
Yes, it was totally normal pregnancy. I was induced at 37 and a half weeks because the baby was big.
Mm-hmm.
So when Ralph was born, he was 9 pounds 5, big bubbly
big baby.
Yeah. So he was born on the 3rd of August, and 9 days later, when I went to bath him, he didn't struggle. Then I tried to give him his bottle and he was sucking the bottle, but no milk was coming out. Mm-hmm. So I would have had a tendency towards anxiety. So I think that played if there's a positive to take out of anxiety, I think that was it that day, because it caused me to phone the midwife, which incidentally was her last day to visit me. Mm-hmm. So I contacted the midwives and fortunately Kathy Nicholas, midwife, knew me well and knew that I did struggle a bit with anxiety, so she said that she would come as early as she could. So she actually appeared very quickly. She must have literally turned the car and appeared very quickly. And we both sat and we looked and we couldn't figure out, I couldn't tell her what I thought was wrong and she couldn't really see anything wrong, but I knew something was wrong.
And this wasn't your first child, so you knew
was
before
the third.
what it was like to feed a child, and
yeah.
There was something in your instinct telling you that something wasn't
right.
Okay.
Yeah, it just didn't seem the way it had been a few days before it.
Okay, so that was 9 days after.
9 days.
So this pregnancy went well.
Yes, everything totally normal. I had loads of scans during my pregnancy. Everything was totally normal. There was nothing. But the problem with the coarctation is that you aren't aware of it until the fetal circulation kicks, or the main baby circulation takes over at 9 days, and this wee flap closes over. Okay. So it's when that happened that the problems.
Okay. So then when Kathy was there then, she decided then that...
She decided to phone the doctor. She thought that maybe it was an upper respiratory tract infection. So she phoned Dr. Jerry O'Flaherty, and he was amazing as well. And he made the call to go straight to Altnagelvin.
Okay.
So...
And then once in Altnagelvin,
Yeah, when we went to Altnagelvin, talk about luck and things rolling our way. That was a Dr. Corrigan who was in Altnagelvin, and he had been in Clark Clinic in Belfast in the heart unit. So fortunately, he recognised fairly quickly what the problem was, because other doctors had looked and couldn't find what was wrong with him. So Dr. Corrigan spotted what the issue was, and it all just went so fast after that.
So whenever the doctor gave you that that news that this was at this time, did he say the words coarctation of aorta, or did he say there was a heart issue?
He said a heart issue. Heart issue. Yeah, he said he felt that he was fairly sure it was a heart issue, and
at this
that
stage,
he would need to be transferred.
What was Ralph's symptoms at this stage? Were there visible symptoms of breathing difficulties?
Well, his heart was, you could see his chest was starting to work harder and harder to breathe, and obviously the heart just wasn't working properly.
Okay, so when the doctor said that to you both, this is a heart issue, what was your reaction mentally?
Oh, the world just stopped for me.
Disbelief, shock, mixture of everything.
Fear, total fear.
Fear of what was coming next.
Yeah, they warned. They told us that he was a very sick baby, and they advised that we would have him baptized.
That was tough. Hearing those words. What about you, William?
I think from memory, the
I've passed my dog on. Have a wee drink. Give it a wee second.
Oh, we did flat. I think for me, we thought, excuse me, we had the perfect child.
Yeah.
Because in those first 9 days, he was sleeping a lot. And we didn't know, but he was actually dying in front of us. Yeah. We had no idea. And when we got to the hospital, the doctors that looked at him first just couldn't pinpoint what it was. And then Dr. Corrigan, he wouldn't have been with him 2 minutes till he sort of said, I know exactly what's wrong. And he took us to one side, and he didn't actually then. He nearly put us out of the room, and he said, I'll talk to you in a minute or something like that. And he did whatever he had to do. And then he took us into a side room, and he said, look, this child is very sick. It's a heart issue. My legs left me. I was standing up, and Leslie's father had to hold me up.
Right.
So that was the shock, because, as I say, we thought we had this perfect child, slept a lot, was no bother, It
was total disbelief.
It was total just disbelief
that
this. And I think that was the biggest shock that I had, because, I was away playing golf that morning, so I had no concerns.
So everything was normal, and it was, new baby had arrived, come home, everybody had settled in, and everything was going really well, and then boom.
It just was,
changed everything.
Circumstance just in a flash.
Yeah.
And then I think the worst part was whenever, well, apart from telling us to get him baptised, that was tough, but when they said they would have to transfer him to Belfast, and they were going to get him an incubator, and we were going to take him, and said to us, don't you follow the ambulance, just you go home, have a shower, get a bag, you're going to be staying in Belfast for a few days at least anyway. So we left him, that he was ready to go in the ambulance. We went home, we had a shower, we got the bag, we went up the road, didn't speed, we just drove up normally, got to the hospital, done, inquired what ward he was in. There was no sign of him. And to me, you know, he was getting into the ambulance when we left the hospital in Derry, and this was, you know, like 3 hours later, and he still wasn't in Belfast. But he had problems. Dr. Corrigan had problems getting him stable enough to go in the ambulance,
Right.
and that was the issue. And we asked if one of us could have went with him in the ambulance, and he said no. We found out afterwards that was because in case he died and there was going to be a handling.
He was a very, very sick.
So he was
baby.
very, very ill.
And did you realise, both of you at that time, that this was a really, really serious situation?
I think at
Yeah,
that
we
point,
did.
that's the time that I realised,
Kicked
you know,
in then.
we knew when we were told it was a heart issue, but when he was so ill that they couldn't move him, you know,
Yes.
that we said, no,
Realised this is
are we going to go
worse
back
than-
down the road to Derry or what's happening here? And then about half an hour after that, he turned up.
And that
you
was
couldn't
it.
even see him.
We weren't seeing him. He was straight
It was
onto
all- and it was
ICU.
all
and-
tubes, all. He was completely. Oh, it was horrendous.
Everything, oxygen, tubes.
Yeah, everything.
wires.
Two doctors, two nurses with him. Yeah, it was really hard. It was really scary. It was really
Yeah, that
scary.
was the worst part, I think, for me. But Dr. Corrigan went in the ambulance with him because he didn't want to take any chance on leaving,
Amazing.
you know, that he could.
What about your journey then? That's a long journey to the Royal Victoria Hospital from where we live. So
Yeah.
that is quite a long journey to be travelling with the knowledge that this is not good. What was going through your minds? How did you manage that journey even?
Well, my dad drove and my mum sat in the back with me when he sat in the front. And nobody spoke till we hit the motorway. There wasn't a word, not a word, because nobody knew what to say. You know, and I think the one thing I really remember most about it was I was afraid to even pray because I was afraid that if I did pray and something happened and Ralph didn't make it, that I would blame God for things not working out.
The fear
I
was
found
so
that
great.
very difficult. I found it very difficult. But I remember I didn't say anything. My mum just turned around on the motorway and said to me, you know, Lesley, enough people are praying for Ralph. You don't need to worry. You know, and that was something I never forgot it. You know, but it was really, until I think you've gone through that, it would be very difficult to explain to
understand.
anybody.
Yeah.
Yeah, I think the fear of losing a child must be for somebody who does, because we're so lucky we have Ralph.
Yeah, and that's why you feel.
And that's why I'm so
like
thankful.
that,
There
yeah.
wouldn't be a day that I don't think about some part of that journey or think about how lucky we are. You know, Ralph would have got away with murder when he was a child because you just you couldn't have been cross with him about anything. Sure, you couldn't, but he was really just that, and he was that most lovable devil too.
So,
I think that Leslie thought about it slightly differently
Yeah.
from me.
Definitely.
Like Leslie would have been thinking all the time, he's going to, you know, not make it or something's going to go bad, you know, whereas the way I would have been thinking was, you know, not worry or not panic about it until there's something to panic about, you know. So, as I say, when I got to the Belfast and he wasn't there, and the doctor in Belfast says, well, there must be something wrong, you know,
yeah,
that's when I started to panic.
yeah. It probably takes a lot to kick that fear factor into you, possibly, and it's probably that, you know, we're dad.
Well, I think you know, the way I would explain it now is if we're driving along the road, Leslie and I, and we meet an ambulance with the blue lights on,
Yeah,
Leslie's attitude or her comment will be, oh, geez, there's somebody in bother. And my comment will always be, there's somebody getting help. And that's
so
just
that
the difference.
shows the way that the mind works and how
Yeah.
you struggled through the whole episode, and the trauma's still there.
Yeah.
So that's going to react in different ways with
Yeah.
you, with anxiety. There, you know,
Yeah.
it's going
Yeah,
to be
definitely.
different ways.
I mean, I have severe health anxiety as a result.
Yeah.
And I
And
do
how does
think
that
that's where,
affect you?
even to see the word health, you know, can trigger me. going to a doctor, anything was just absolute terror. I just go through the emotions again of how I felt. I'm
Yeah.
expecting bad news
Yes.
all the time.
And whenever you saw Ralph in that incubator with the wires, the oxygen, all of those machines attached, you know, what were your first thoughts then? How did you feel then?
Like,
How
I was
did you-
just total fear.
It's
that I was
scary,
going to lose him.
isn't it?
The
Yeah.
fear is horrendous. Yeah.
And was there any mental health support at that time?
No.
So
No.
who supported both of you through that time?
Supported each other really,
Yourselves?
and you know,
We've got a good bit of support
our family
from
were very good.
family, and the Heartbeat Trust were very good.
Yes, they were
Yeah.
fantastic
The
organisation.
other parents that were in the same or similar situations,
Yeah.
you know, Heartbeat had a accommodation that we stayed in Belfast
Yes.
to be near Ralph, and we had got food and whatever
Yeah.
provisions, or somebody had brought them, and we had put them into the fridge, and we came in at night then after being hoofed out of the ward, sort of 1 o'clock in the morning or whatever it was, that you know, told to go and get some rest. So we went in. Of course, we went to make a cup of tea, and the jar of milk, or the carton of milk as it was in those days, had disappeared,
Yeah.
and it was frustrating, you know.
Yeah.
But actually what had happened was some other parents had come in, and they were also, and they thought, this is great, there's tea and everything here.
Yeah.
And they had a bowl of cereal and whatever,
Yeah.
you know. And we met the guy that actually drank most of the milk the next the next morning, and he was we didn't know it was him, obviously, but he came and he said, this is a great facility here, you know.
Yes.
God, we come in last night and everyone was sitting there for us, and we were going right there on it, you know.
That's William turning the positives again, you
Yes.
see? Yeah.
But we still,
thankfully.
I've met that guy since, you know, like 20 years later. Hadn't seen him for 20 years. Met him one day in Belfast, and his son came through as well, a different problem, but
Yeah, but in the same.
got well as
part of the
well.
hospital.
And you know, it was
It was a great facility
wee
to have that,
strength
because
too
we
to
wouldn't.
have. Yeah.
Yeah.
We didn't want
You
to
had to
leave
go
the
home.
hospital. We just wouldn't have left him. We would have slept in the car. We just wouldn't have left.
And even
know.
at that, you know, when you're not with them in the unit,
Aye.
there's still that separation.
Yeah,
You
big
know,
time.
and that hits you as well later in life as well.
Yes,
That separation
exactly.
anxiety.
Got
I'm
that
not
too,
sure about
Belle.
Ralph, has he got separation anxiety? Sometimes it does affect the baby, but you definitely have separation anxiety whenever you're apart from them. And you know, you didn't have to go home, but you still had to leave him
Leave
there.
him.
Yeah.
You still had, and as you say, that ambulance experience.
yeah.
When you left him, he was getting in the ambulance. Why is he not here? 3 hours later, you know, that's all
Oh, it was so scary.
panic and trauma and all those things wrapped up together. Whenever you were in the hospital, how long was Ralph there? You know, before the operation, how long did he have to wait?
I would say
4 days.
3 days, was it? No.
Well, it was on the
Actually, I think
14th
it
day.
was supposed to be 4 days, but what actually happened was the baby in the next cot, it was due to go on that day. When they took the nappy off, there was a bit of blood or whatever,
Okay.
And they had a temperature.
and
Yeah,
they had a
so they
temperature.
couldn't
So Ralph was then moved into that place. So we, you know, but a lot of the anxiety had dissipated at that stage, because the people in the hospital, the nurses and the doctors and all, were so good, and you could see it. Ralph had been stabilised. His wee chest wasn't, you know, being sucked in and one thing and another. You could see he was just perfectly normal. So
But he lost a lot of weight.
he lost a bit of weight, yeah, but
What weight was he at this stage?
He was 9'5" when he was born. He went down to 5'8".
Gosh, that's a lot, isn't it?
Yeah.
Yeah.
So, yeah.
So with the operation then, talk me through what happened. Were you prepared for that? Where did you go when he was in theatre? What was that
We
like?
weren't prepared for it now because he wasn't meant to have it that day. So to me, when they came and
Unexpected.
said, you know, you have 45 minutes, we're taking Ralph, he's going to have a surgery today, I went to pieces again.
So it was good in a way that he was going to be treated, but
Brilliant.
you weren't mentally ready.
No, I
this
really
is another
wasn't.
major step here in anxiety.
Yeah, and I just went to total pieces, and I needed my mum and dad there. They weren't even going to be there in 45 minutes. You know, it takes an hour and a half. But they did come. They didn't see Ralph before he went around, but they did come, and I remember handing him over, William, to you, and William carried him.
The surgeon that was going to be doing the operation, Mr. Gladstone. He was an older guy, and what I noticed about him was he had very slim, slender fingers.
So
thin. He just looked so refined, and you were sort of saying, the way he was explaining it to us, what he was going to do, you just knew, you just had a confidence straight away. Well, I did anyway. A confidence straight away that he was going to do the job and it was going to be 100%, So I wasn't as worried about Lesley. I was happy he was getting in and he was going to get it today rather than wait another day.
Yeah.
And, that the whole process was moving forward. And Lesley, she was...
was just
sitting in the chair more or less outside the theatre, and she couldn't stop crying, and I was looking out the window, wondering now will we get home tomorrow, sort of thing.
Yeah. Two different outlooks.
Total. I was afraid to be hopeful. I think in case
so many fears.
Yeah, in case again,
wasn't going to work
out. Yeah.
And then, do you have anxiety? Do you suffer from anxiety?
A bit, yes.
How would you deal with your anxiety?
I usually would say something to Lesley, and she would say, "Oh, I've had that millions of times," So you then know that there's nothing wrong with you, like. But,
so two different ways of dealing with stuff, but that's a maternal anxiety as well, with perinatal mental health as well. With every birth and every thing that happens, and the trauma and the birth and all that thing. It's a maternal thing, I think,
I think
men do have different ways of dealing with things.
You have to have a different way, because
different perspective.
I could see all the things,
outlook.
over the years that was happening to Lesley because of anxiety.
Yeah.
And it was getting to a stage where you sort of got fed up with it, that inconvenience of it.
Yeah. And it is as debilitating for the person that has it, but also for
she couldn't be left alone, so she was fine when she went into work because she was in with people she knew and she was comfortable in that environment, but at the one stage she didn't even want to be left alone in the house.
Yeah.
So if you're going to the shop for a pint of milk, you had to get her and the kids into the car to go to the shop, which...
It's excessive.
Oh, it was excessive.
It was excessive, yeah.
Well, it was excessive.
Affect your life.
Yeah.
And that's since...
Yeah, well, now I'm a lot better now. I wouldn't be anywhere near... But
what helped you? What helped you overcome?
Probably William.
William. There you go, William.
There you go.
Very good.
Sometimes I think, that I wasn't forceful enough with dealing with it, that
encouragement, you mean?
Yeah.
Well, not encouragement, more it was maybe too soft.
Too soft, whatever Lesley said, I just, she says I want to do this, well, then that was it. Stupid wee things that were making her feel easier or more comfortable in herself, but were a frustration or an annoyance to me. And I got to the stage where I just, you sort of had to accept these things, or you were going to, be affected yourself. So
turn it around.
Yeah. So you moved on then, and sort of once you were more accepting of it and understood it better, probably, then you were able to help more and easier and do things that was going to help her, and that's why then she probably got better over the years.
Yeah, that's right.
I didn't
have anxiety at that stage.
No.
William's crept in much later. Much later. Like we're talking 8 or 10 years ago.
And would you say that as a result of everything that happened in the past, as a suppression of it, or
I don't know. Do all married men not get that? No.
No, I don't think so.
Can you cut?
We'll go back to the hospital anyway. So we'll go back to the time after the operation then. So during the operation, stress levels were building, anxiety was the worst it possibly could ever have been.
Yeah.
You got each other through it.
Yeah.
Yeah. Your parents didn't get to see him before he went in, and
No.
I'm sure that was really hard for them.
They would have seen him, every day leading up to it, but they didn't see him knowing that he was actually going for surgery.
Yeah.
And Jeff, our eldest child, was 7 at the time. And, it's funny how it affects the whole family, because my brother was looking after Jeff at the time, and they brought Jeff up to see Ralph the day before the surgery, which we didn't realise was the day before, but he came up and they were on the motorway going home again, and Jeff started to cry because he hadn't given Ralph a kiss goodbye.
Aww.
So Adrian, being Adrian, a softie, he drove right back into the hospital again. And, I often think, thank goodness he did do that, because, that would have been a big thing for Jeff to have coped with if,
go home.
because mum and dad were away and the new baby was very ill.
Yeah.
So.
And then what about your side of the family? Were they able to
They
support?
did. They did come up to the hospital too, but they didn't want to be in the way.
Yeah.
And you were restricted to the number of people that you could, you sort of had to take in turns to go in and sit in the unit.
I would say grandparents are third parties, but they're very much involved in this, event in your life.
Yeah.
But it is hard to know, where do you go? What's best for us to do?
Definitely.
And it does affect the whole family.
Oh, it does.
When you think about
So
it,
much.
it really does. So after the operation, Ralph was taken then to intensive care.
Yes.
And what was that like for you?
I was hugely relieved in the fact that it got through the operation.
Yeah.
That was the first thing, really, that was the first relief kind of that I got, was that he had at least got through the operation. But for anybody who knows intensive care in the Royal, they were lined up. There must have been at least 25 people in that ward, and he was the only baby. It was all older men and women, but
he wasn't in there for very long,
No,
but
he
they soon
wasn't.
moved him back into
He did so well
and
straight after the surgery. And another thing that sticks in my mind is that a coarct or the aortic valve, or the aorta in a baby is the size of a lead of a pencil. Crazy, isn't it? To be able to go in and find
So much power.
Yeah, and his was 67% blocked. So they went in and did an end-to-end anastomosis, I think it is, and they cut out the piece and stitched it together again. So that was what he had done.
And how long was he in the hospital then after the operation?
He actually he did very well. I think about 6 days he was in after.
And everything went
to
plan?
Fully to plan afterwards.
What about your anxiety for those remainder of those days?
Well, no, it started to ease definitely.
The more he was getting
the more he got better. Yeah. But it was frightening. I remember we got home on a Sunday and we were tired. We couldn't take our eyes off him.
It's having that disconnection from medical.
Yes, that's right.
So that's
right.
You're responsible here now.
Mm.
You know, if anything goes wrong, but I mean, your instinct would tell you again, Lesley.
Yeah, but when you sleep, my concern then was
whenever you're sleeping.
Yeah, could something happen? Mm-hmm. So then William sourced some kind of a monitor, and you put it underneath the mattress, and if they was I don't know what it was. William,
there were newfangled things then, but
gadgets.
We used it, and it helped enormously. It let me sleep because I couldn't sleep because I was so afraid of something happening. But this monitor was brilliant. The only problem with it was if he rolled off the pad,
Beeped,
the alarm
alarm
blipped.
went again. And talking about bleeps,
Oh,
all
can't.
those bleeps in the hospital, how has that left you?
Oh, I can't even watch Casualty. When I hear the bleeps in Casualty,
What does it do to you?
I panic. Just fear. Just that awful, intense fear comes back.
Would you be the same, William? Or
No.
Are you different?
No,
You're
not at
different.
all.
Yeah.
I mean, you know, we had a very good result.
Yeah, and I'm so thankful
Yes.
for that.
And
That's what
why
it
you're
is.
that's
That's-
relief that you're
it
feeling.
is relief.
It's actually relief you're
Like,
feeling.
I'm so thankful.
Yeah.
So
And I think the
thankful.
more you talk about it, the more that, the relief is there. But the more you talk about it, the more that pain will
Yeah.
come out with it. And that's why we encourage these conversations on the podcast, is to normalise that some experiences aren't
Yes.
straightforward.
Mm.
They're
Yeah.
not happy. They're not normal.
Yeah.
During that's a terrible long journey of fear there that you have come through, to the end of that operation. And I suppose if I was to ask you now, looking back 25 years ago at yourselves, 25 years ago, is there anything you would have told yourselves? Is there anything you would have said to yourself or asked for differently or done differently?
Hard to know because you're
was so
depending on
fast.
these professionals. I mean, there was a guy, Sands, who worked in the unit, and he would have been
Sands.
Andrew Sands. He would have been involved with the surgeon and organising for the operation and all the rest of it. And he actually monitored Ralph for a good number of years after,
Years.
and you sort of, when you got to know that these people were experts.
Yeah.
So therefore my thinking was, if these boys say this, that's grand, that's what it is. Whereas Lesley would have been wondering all the time. I think you're better to, you don't panic or don't worry about it until there's something to worry about. But after we got home, I remember the first day after we got home, and when we took the baby grow off to, and there was a scar that went from the middle of his back right round to his chest, and we'd seen this before, obviously, but it was just, you're dealing with something, in your care then, something with such a, the bit on the aorta that you couldn't see was bad, but the bit on the outside where it was, you were, trying to make sure to lift this wee guy right, because I don't want to put any stress on
like
that
an egg.
joint, or whatever.
Yeah.
And it was like that went on for a good while.
Yeah.
That you had to be so careful. So I think that probably increased the stress and anxiety of it for Lesley.
Yeah.
Yeah.
It wasn't just to say it was the 10 days that you were in the hospital. It went on for,
It's a long time
a long
after.
time after,
then.
yeah.
26 years. And
Yeah. And did you have any more connection with the Heartbeat Trust, or any more involvement through any workshops or anything like that, or support or anything after that?
We did, yeah. We had, when we were still getting support from Heartbeat, after we came home, people would have been calling and saying, is everything all right? How are you getting on?
they were very,
For
very
a chat,
good.
they were very conscious of how your mental stability was, and they wanted to be there to help any way they could,
Yeah.
And then it was, I don't know how long after, months, we decided we would do a fundraiser thing, as a lot of people do, and we did a night at the races.
Brilliant.
Your mum was at it. Were you at it? You were.
Was I? Probably was.
You probably were. And we raised a good bit of money, and we split it between, I think, the Heartbeat Trust, the Children's Unit in Belfast, and the Children's Unit in
Brilliant.
Altnagelvin. So,
Very good.
so that, and we probably had contact with those people in Heartbeat maybe for a couple of years, and then sort of faded out after that,
So you found them really supportive at the time?
They were, yeah.
Yeah, and
They
you'd
were.
recommend that anybody listening would
Yeah, definitely.
definitely avail of it.
Yeah, definitely. Definitely.
So what would you say then, Lesley, you first of all, from the bottom of your heart, to somebody going through this similar situation right now, somebody listening now, what would you say to them about the whole thing, the whole journey? What advice, what message would you send to them?
Oh my goodness. There's no point in me saying don't worry or don't be afraid, because I think it's a natural maternal instinct to be like that. But I do think, allow other people to help and support you and talk about it. I think that's important, to feel that you can talk. Like, we were very lucky we had each other and understood each other and were able to talk about it. And, William was more than brilliant in supporting me. I couldn't have done it without him, just.
And what about you, William? What would you say to somebody?
I think that you have to have faith in everything, the man above and the people that are you're working with you, and people that we were again on the Heartbeat Trust, they were all people that had went through a similar experience, so they knew how you were feeling, and it was sitting down for 5 minutes and getting a cup of tea was, you never realise it at the time, but it was a great help. Like.
Yeah, definitely. Just to know that other people have been there
and understand it, and
exactly,
and then you're trusting their experience to guide you, and to know that there's an end to this.
Yes, there is an end to it. Yes,
because Ralph is doing really well.
Yeah. Oh, he's brilliant. He plays rugby, plays loads of sports.
Yeah. So you've both chosen to give back to support others because of your journey. Mm-hmm. So what has inspired that, and what does supporting Nicu&You mean to you?
I think that it's something that you always just be conscious of, that you want to,
Not everybody gets a positive.
Not everybody gets a positive thing, and we were just so thankful. But it's not to say you're going to support everything that comes up, every charity, but like maybe 10 years after it happened, there was a fundraiser, and we contributed into it. A friend of ours then had a wee child, and they lost the child. And you know who I'm talking about, in Balmagary as well. So that was a difficult period, but we had good conversations with them when they were going into hospital and all, and it just didn't. They weren't as lucky as us, and that's very tough.
Very tough. I think a lot of young people too think that you just get pregnant and have these babies and things will be grand, but they don't always just go according. Not everything. Yeah, not everything. And I think the other one for me is, Belle, for what you've put into this. I think that's why we want to support you as well, because really it's coming from your heart and soul, really. We see this a mile away. And I think what you're doing is amazing. Brilliant.
Thank you.
Brilliant, I think. Amazing.
Okay. So just to summarise, for those listening, coarctation of the aorta is a condition a baby is born with, where the main blood vessel coming from the heart is narrower than it should be. In the early days after the birth, everything can seem completely normal, and then suddenly a baby can become very unwell quite quickly. Because of that narrowing, the heart has to work much harder to pump blood around the body, and that's when symptoms can start to show, like difficulty feeding or changes in the baby's breathing. For parents, this can feel awfully frightening and unexpected, especially when everything seemed so perfect just days before. The reassuring part is that with treatment, often surgery, this condition can be repaired, and many babies do go on to do really well. Lesley and William, thank you so much for sharing your story with such honesty and courage. I appreciate how difficult it has been. Your journey is a powerful reminder of how quickly things can change, even after a normal, full-term birth, and how important it is to trust those instincts as a parent. It also shines a light on just how far support has come, while recognising that at the time you carried this with true strength, with love, and with each other. Your story is one of resilience in the face of fear, and it will resonate deeply with so many families who are listening today. I want to say a very special thank you not only for sharing your experience, but for the way that you have given back and continue to give back. As sponsors of the very first series of the Nicu&You podcast, your support is helping those stories to be told, helping other families feel less alone, and creating something truly meaningful from your own personal journey. That is incredibly powerful, so thank you so much.
Very welcome.
Thank you, Bill.
If this episode has resonated with anyone, please consider subscribing to Nicu&You wherever you listen to podcasts. Leaving a review or sharing the episode really helps these conversations reach the people who need them most. You'll also find links in the show notes if you'd like more support or information. And if this story has touched something in you, please remember, things can change so quickly, but so can outcomes. Take the journey one day at a time, but trust your instincts and never hesitate to ask for help. This has been Nicu&You with Belle Stevenson. Until next time, take care.
Recorded at and produced by 9874 Creative.